honest questions with honest answers. This is Unfiltered, brought to you by the Emergency Medical Minute.
Wait, do you still play soccer?
I played last year on like a co-ed pickup team.
You should play on my brother's team.
Yeah, they did.
They're like
I would,
decent.
yeah,
they're they're all
the
like
ball
our
like
age.
is like passed between
Yeah.
players,
And they have like some players who played college and some who didn't.
Yeah, I'll play.
And then they're always looking. But although no one's playing right now.
right, right, yeah.
Sadness.
I would be awful. I bet if I played,
I'm awful. So.
just because I haven't played in a while, and yeah, I'm a lot heavier than I was when I played.
Yeah, same with me. It's like I played tennis.
It's all muscle though.
Yeah,
it's all
muscle mass below the fat.
lean muscle mass.
Yeah.
Yeah, I'm cultivating mass so I can go faster down the hill when I ski.
They say muscle weighs more, but somehow I'm heavier.
All right, let's just start.
We started already.
Did we start already? Yeah. We will at some point re-splice in all the things that you've done. It's a lot. We'll put a link to his bio. We don't have time to go through it all. It's long. It's called and impressive. The list is long and distinguished.
A bio of an undecided person. That's what they look like. So if you can't figure it out, just do everything.
A perpetually unsettled individual, which is not a bad thing.
Sometimes. That's my wife. She really enjoys it.
Enough with the malarkey. Ladies and gentlemen, welcome back to Unfiltered. Today we are privileged to have our guest, Dr. Ricky Dhaliwal, MD, JD. Dual-trained IM physician, extensive and diverse background. He's worked with cybersecurity. He worked in the Government Accountability Office, trained at Hennepin, worked at Hennepin, president of EMRA, man of many hats and many impressive accomplishments. We're happy to have him on and look forward to talking to him.
Yeah, thank you for having me.
Yeah,
I'm
absolutely.
excited.
Thank you.
To be able to stare at your tired face after an overnight.
I am acutely delirious.
Yeah.
I think the listeners will notice a very distinct difference in my voice today, and that is acute delirium, folks.
I mean, your bags are definitely lower than your what?
My eyes.
Right now. Yeah,
I think it's my eyes
those
that you're referring to.
That's what I am.
You, on the other hand, look great. Just finished a shift.
Yeah, right. Things are great.
I wish this were a video platform. You look super handsome.
Yeah, that's what Indians always look good. That's what we do.
That's right.
That's what
Timeless, ageless. Ageless. Speaking of being Indian, tell me about your upbringing. Tell me about what it was like growing up.
Well, I grew up in we were first generation family. My parents immigrated to the United States in the 60s. Well, my dad in the 60s, 1968. He went to the University of Wisconsin. He came from a tiny, tiny, tiny village, which I've been to, and my wife is white, and she was the first white person they'd ever seen. And in India, everything's competitive. So his ability to actually get out was huge. He was like the top out of hundreds of thousands of people just to get into engineering school. And then the top of that, to be able to get a spot at the University of Wisconsin. Then, they were very, very poor. And so his family put together as much money as they could from their farming. They had a farm, and were able to send him out here. And so he moved and left everything he knew all by himself in 1968 to Madison, Wisconsin. So he's a young guy with a turban and nobody. And he figured it out. He went back to India, met my mom, got married. She stayed there. He finished school, moved to Ohio. She finally came. He was, working out in Ohio and in Pittsburgh, as he's an engineer, mechanical engineer. I was born in Ohio.
East Liverpool, Ohio.
I don't like to admit that very often, but it's true. I can't.
Both of us born and raised in Ohio. Not really raised. You weren't raised.
I was there for a month. It was a glorious glorious month. Yeah. And then we moved to Rochester.
Shout out East Liverpool Potters.
East Liverpool.
Yeah, blue and white.
Yeah, right? Mm-hmm. So my sister, she was born in India. I was born here. Potters, huh?
Yeah, that's their mascot.
Oh, that's a good mascot.
That's another podcast.
Sister born in India. I was born in Ohio. Moved to Rochester. My brother was born there. And then we lived in Germany for a couple years.
What?
Because my dad was with Kodak. And then
that's right.
Came back and then lived in Colorado since I was 12, 13. So Fort Collins, Colorado, baby.
Well, yeah, your dad is a badass.
My dad and my mom both.
Yeah, true. Yeah, absolutely, of course.
So, they sacrificed a lot for us to get out here. And so, luckily my older sister, my brother and I have, we've been lucky. They provided a stable home with the Indian culture and kind of blending in with being American. I would say that they were probably a little sad that we've lost a few things like language. Although we're trying to get it back, we understand Punjabi, but speaking it, of course, just like any first generation, you're like, I'm just gonna speak
I'm gonna
English.
assimilate, right?
Yeah, assimilate. And so, and then. So pretty much everything we do is nothing compared to what my mom and my dad did. To get us
Did they talk about that a lot with you growing up? I mean, this is where we're from, and this is what this is what I had to go through to get you the opportunities that you're having, or was it kind of implied, understood, or?
No, it's fine. Like, so they talked about where they were from, like, so we knew we were Indian, our community was Indian, but, my dad, never really said that until we were older and we started really questioning about it. And you realize like the crazy sacrifices him and my mom went through to get here. It's like, it's unbelievable, honestly.
It is.
Like the story of them getting here and, how they've kind of made their way, and now a good middle class family is impressive.
It is.
So.
It is. It's an incredible story, and it's an American story. As we've talked about that a lot. That is an American story.
Yeah, I mean, I'd like to think that,
Yeah.
and so this day and age things have changed a little bit, but I think that's still the story.
It is. I agree. And they must be really proud. Particularly of your brother.
Yeah. Oh yeah,
Yeah.
Right? Like we do have a golden child. It is my brother. He. And he will always rub it in. But I'd like.
Well, you can't win with all of your kids.
Yeah, exactly.
Right? And you married up.
I did.
So
I
they
married
can
up.
be proud of you in that way.
Well, that's the thing. I married a really smart lady, and so that hopefully puts a little bit more positive.
They're not
going
going to kick you out of the family.
Not yet.
Because she's in the family.
Luckily. So
So
that's why I got to make sure she doesn't divorce me.
Right. Good
So,
point.
yeah.
Good point.
So
Yeah, she. There will be better options out there.
I mean, every day.
Over the course of her life.
Every day.
Yeah, every day.
Yeah.
It's a good point.
Even today, she accidentally called me while she was trying to get a consult. She's like, "Oh, I must have hit the wrong husband button." It happens.
Yeah. Just win the day. Win today, and
That's all you can do.
yeah, she's there in the morning, and it's a win.
Hope for a good tomorrow.
Your kids are there, and
Yeah. Like luckily, the kids actually aren't here right now. Well, not luckily, but we're working a lot, so mom and dad are helping out.
That's
which
awesome.
Is an important thing when you have a 2-dog family.
yes. Tell me more about that. Tell me about balancing that life, family. I have a 1-month-old now.
Yeah, good luck.
And it's just fundamentally different now. But you have 2.
Yeah, I mean,
and you're crushing it, both of you guys.
we are surviving. I mean, kids are amazing. I mean, they're like the best thing in the world, right? But it's hard, and I think, especially in the time of COVID, childcare, juggling things, trying to keep people safe. It's definitely been a whole nother world, and that whole childcare thing. When you got 2 people working weird hours, it makes it a lot more difficult. So luckily, Google Calendar is
Yes.
you can make multiple calendars. I don't know if you knew that.
I use a pen and paper.
I've seen you with that.
Yeah, it's
And highlighters.
foolproof.
Yeah.
I've never missed an appointment. Ever. You were the president of EMRA.
Mm-hmm.
What was the best and worst thing about being president of EMRA?
I think the best thing was the people you get to work with and actually knowing you're trying to help residents and the medical community. I think we did a lot of cool stuff to help residents and med students succeed in being and becoming good docs. And I think that was a really cool thing, being able to be the voice for them.
Yeah, present company notwithstanding. Yeah, sure.
I mean, that's not your fault.
Keep going. Can't win them all.
Yeah, I mean, you're born with smart or not, right? But it was a cool experience to be able to do that. Plus, you get to meet these leaders in medicine and emergency medicine that are like the gods, and that was a really amazing experience. I think the hard part, of course, with anything is like your training and traveling and trying to juggle everything, which never changes as you find out. You're like, oh, this is really hard, and then you move on. And if you want to be involved and be a leader, it takes a little bit more effort.
Were you married at the time when you were president?
Yeah, we were married. We got married right before we started residency.
Okay.
Yeah, moved to Minnesota, got married.
You were like, she's going to meet a lot of other residents. I'm going to lock this down.
Yeah, exactly.
Right now.
Let's do it.
I know. Yeah, I got married in residency. I know the same.
Yeah. So lived with my in-laws for a bit. It was a great time.
So what was the worst part about being EMRA president?
I think I'm trying to think.
Time commitment.
Yeah, I guess time commitment. I think that was the hardest. Like just being away from my wife. I think it gets old when you're already busy.
Yeah, it's exhausting already.
Luckily, we didn't have kids at the time, and so that made it a little bit more feasible. But that's always hard. But at the same time, get to travel to great places, meet really cool people and interesting people, and learned a lot of skills like from a leadership perspective.
Definitely. Yeah,
So,
kind of a look behind the curtain early on from an operations perspective.
Yeah.
And all the political stuff. Yeah, I'm sure invaluable.
Yeah, we'll see. I'm
Well,
still working on
one
expanding
day you'll find it,
I'll find out.
and when you find it, you're gonna let me know.
Yeah, I got a couple more degrees and then we'll do it. So we'll get back to you.
You were faculty
Mm-hmm.
at Hennepin.
Yeah.
After you graduated residency.
Yep.
So you've now spent a good number of years in both community and academic jobs. What would you tell folks, who are looking at both coming out of training? What was your kind of thought process, and how has it changed as you've changed settings over the years?
Yeah, I think so. I will say that I was truly happy in the academic world. I think there's something about and being an academician. Mission, yeah.
Mason, look that word up. I'm not sure.
Yeah.
That one, it's a word, and two, what it means, and
Yeah.
splice it out. If splice out what I just said, because I can't not know something as the host. Thank you.
Academician.
Country of origin.
Yeah, I mean, I feel like it pushes you. When you're in that kind of space, especially at Hennepin, they're always been the tip of the spear, right? That's the saying,
That's right.
right?
It's like Guam.
They're one of those programs that pushes the envelope on everything, and so it requires you to really be knowledgeable and be unafraid to try new things. And the only way you do that is by understanding what you're doing, right? And so I think that's yeah. See, it's a word.
It's a word.
Academician.
According to what is that website? Google? Nah, I don't believe it.
Just watch Spellbound.
I don't believe it.
Yeah. So I feel like being in academics, there's a different feel to it. I'm not, I wasn't huge on the research part, but I was doing admin work, which I really enjoyed. And so I think that's one aspect. Then you go to the private world, and I think there's a happy medium. You can still continue to teach and push yourself, but you just got to find a way. So like things like what you're doing, like medical minute, doing things like this. And finding ways to be able to continue like that teaching piece.
Yep.
You can still do it. And the private
APPs.
world, right?
Nursing
But private world's different. Your underlying goal, not goal, but the things that are most important in the private world may be a little bit different in the academic world, right? Whether that be, how you bill things, how much critical care, those kinds of throughput, right? Metrics, but not that those aren't important. They still matter in academic center, but I think there's a different level of expectation, I think, in that regard. So, I think you can find your place in either way. But if you truly love to do, papers and, teach and those kinds of things, I think, the academic world is maybe more suited for you, but there are private jobs, like, what we're doing, at our jobs, that you can find the best of both worlds.
Yeah, it's just got to be the right fit, right, in the right environment. You've had a couple, now new jobs as you've kind of transitioned across places. What would you tell folks if you could pick one question that you would ask, before you go into a new job for someone coming out of training? What would you tell them to ask?
I think first of all, before you even ask the question, you need to figure out what you like, right? If you're someone who needs to get pushed every day and you enjoy that feeling of kind of on the edge, I think that's an important thing to know versus someone who's like, I like to just chill, like I don't need to see the super sick people. I think that's like that first point. And then you got to ask that question, like, what is your practice like? I think that's the most important thing. And they're going to tell you, a lot of times they'll tell you, but there's always going to be a little bit of boofing.
Yeah, we love critical care.
Yeah, things are great. Yeah. So you got to kind of pick through it, and I would say go see the place. Just like residency, it's like, it's a similar kind of thing. Figure out what you want, and then find those places that kind of have it, and asking people that work in the practice, not just the person that you're talking to, who's your recruiter or whatever. From that area, you gotta ask people who are in the trenches.
Yeah.
So,
yeah, that's great.
Yeah. So, I mean, that's why I did a switch this year. I think while the place I was working at, I loved it. There was some teaching that was going on there too, because we had the Denver Health residents coming through. I just missed, the really sick people, and I missed I think I just miss that critical care, but also just the feel of being pushed all the time.
Yeah,
And so,
sure.
we've got that here at Swedish, got that Skyridge. We have there's a lot of other hospitals in the city of Denver that you can get that.
Yep.
So
Yep. You missed me and you
I
didn't
miss
even
you.
know me yet.
That's what it was.
You didn't
actually.
even know me yet,
but I knew of you.
You knew me before you met me.
One of my coworkers there spoke of this man, Tsipis.
All right. What else do you want to talk about, man?
I don't know. What do you want to talk about?
I don't know. I mean, we can talk about anything.
What makes you tick?
It's a great question. I'll be the one asking the questions on this podcast.
Oh, yeah. Sorry about that. You like that?
No, I mean, I think to echo some of your points, I mean, I think we are all products of our environment, right? And I think we'd all like to believe that we have kind of an infinite intrinsic motivation, and if we were helicoptered and dropped in anywhere, we could self-motivate to do whatever we wanted and reach our maximal potential, but that's not true, right? No fucking way. Right? So you need people around you who, like, consciously and unconsciously are going to challenge you and push you to do better. And I think your points about trying to find that when you're looking for a job is true.
And coming out, like, that's a huge thing because you have this skill set that you have and you can lose really quickly. Right?
If you don't use it.
If you don't use it, you lose it, right? I mean,
that's what I've heard. It's true though, and I think, and in the clinical world, that just that mentality of challenging ideas and challenging, if something is literature based, if something is evidence based, and that mentality, the academic mentality of being up to date with literature and constantly refreshing and constantly learning new procedural techniques and best practices. I mean, that's something I would say I continue to try and struggle to find time to do.
Yep.
Right. I mean, I think you get into the community setting and you get into operation stuff, you get into med staff leadership, you do, throughput, you do ultrasound, whatever, but you're not doing monthly conferences or weekly conferences and journal clubs, and you're not being challenged by that, attending on shift who's the critical care guru in your residency and who's going to, rip you about vent settings. And, you're not doing that, right? You're not doing it on a regular basis. And, so you have to find people who will do it and challenge you to do it so you don't look dumb. Yeah. I mean, that's what it comes down to, totally. Right? Like you don't want to sound stupid at sign out.
Yeah, exactly.
Like you don't want to be like, yeah, so he's on octreotide. Like, it's like,
you mean that was wrong? What? Yeah, I mean, but it's also like patient care. Like
totally.
If you aren't motivated to want to give the best care that you can give, I mean, then you're not going to push yourself to keep getting better.
Yeah.
Right. And I think that's what it all comes down to. Like, I feel like if every physician should strive to give the best care they can. And the only way you can give better care is by knowing that you need to continue to learn.
Yeah.
Right.
You've got to be humble, right? I mean, the patients are put on the earth to humble us.
It's true.
First, second, third, and fourth. I mean, that's if and when, I retire, that's going to be like my career tombstone is going to say
humbled.
Here lies Nick.
Mic
humbled
drop.
On a daily basis.
Mic drop.
But it's true, right? I mean, it's atypical presentations and it's changing, therapeutics and diagnostics, and it's humbling.
Yeah. Well, and then you got to find time for all this stuff. You just had a kid. I mean,
plenty of time.
Your priorities change really quickly.
It's true. This might be the last Unfiltered for a year. I don't know.
I mean, probably.
It might be.
Well, just remember, if you don't use it, you lose it.
Ooh.
There's another thing. Pay. I think, a lot of folks, and including myself, you come out with a lot of debt, right? And so you're partly.
No, not familiar.
Never, right? So you're partly.
I paid it in cash.
Yeah. Now you're.
Every month, I walked into the registrar's office at my medical school and just dropped a big stack.
Oh, that's nice.
Yeah, and I just said, "Don't ask where that came from."
I'm not going to ask.
Don't ask. Yeah, it's not going to be on this podcast.
I was noticing you got a lot of scars there.
Whatever it takes.
Whatever it takes.
If you don't use it, you lose it. Keep going. What were you saying?
No, I was just saying, you're driven now, like, from a financial standpoint.
Yep.
Like,
Yep.
Sometimes people can't take the jobs they want because it doesn't pay as well. I mean, I'll tell you, like, living in Colorado, we are 50 out of 50 in terms of pay from any other state in the country. And I left Minnesota, which is very high compensation place for emergency physicians. and it's a huge deal, right? But at the same time, I would say that I'm in many ways happier,
Yep.
because I'm in a place that after I get done with work, I can truly enjoy. Not that I couldn't in Minnesota, but it's just like a different world of
Sure.
it,
Sure.
being near family, that kind of thing. So,
Yeah. You just have to put those variables into your family's equation.
right.
Yep.
And things are,
But the slope of that line is very different.
yeah, right. Yes, it is. That slope is very different. Find a side gig. We could talk about? We could talk about advocacy in medicine.
Let's talk about that.
Yeah. I mean,
You're a man of color. Tell me about what it has been like to be a man of color practicing medicine in the last 5 to 10 years and what I, as a white man, don't understand about that.
well, I mean, I think honestly, like, there's been few episodes where I've had issues in terms of being, Indian. I definitely would say females and folks of, other backgrounds probably have more difficulty. But I think that, the go-to isn't just being a person of color practicing, but it's understanding the patients that we have, right? And so if you don't allow yourself to understand everyone and have an open mind, you're probably not going to get to the bottom of some of the medical issues that are happening, right? And you're like, well, why does this person keep coming back? If you actually like delve down and find out, well, their home situation is really rough, and because of that, they're not able to get their meds. That's unstable, and that's why they keep coming back.
Yep.
Maybe you could make a huge difference in terms of their outcomes, and I think that's like, part of our job. In this day and age, unfortunately, it's about throughput, right? And it's about, getting people in and out. And because of that, I think sometimes you miss it. And that's where maybe in these academic settings or some of the smaller community settings, you may have a little bit more opportunity to actually explore that. And so I think that's something that's important. But I also think like one of the other pieces when I say advocacy is also like advocating for medicine, and you look at what's happening, right now, insurance companies and hospitals, they rule, right?
Yep.
Physicians have become like second and third fiddle now. Providers are no longer the ones driving care in a lot of places. It's, bottom lines and, nursing and unless physicians, EM or whatever, really try to take hold of this and understand it, it's just going to continue to get worse, and we're going to be less and less happy with our practice.
I was going to say that is time and time again shown by studies to be one of the leading causes of burnout.
Yep.
Lack of control of your own practice.
Yeah, like the autonomy.
Autonomy.
Right? We love emergency medicine is all about autonomy, and if you don't have that, like, it sucks sometimes, right? Just think about like your last shift. If you're like, well, I need to do these sepsis criteria, right? I got to do this, even though you think it may not be the best practice. That's what we're doing, and part of it is because we haven't been advocating for ourselves, And then you look at other things like out of network billing. I mean, everyone knows in the medical world that this is an insurance issue, right? But we have done a piss poor job of educating the public, and we're doing that. We haven't done that because we're so busy doing other things. So we're like, well, that's not going to change.
That's right.
But it could. So I don't know. I think that the next phase, and that's really important from people who are coming into emergency medicine, is that you got to take the time to understand the issues that are happening, because it's going to affect you like a lot, way more than you can think in the next 5 to 10 years.
I believe that. I think you have to understand how the health system works, what the health system prioritizes, what's the language of a health system administrator, right?
Yep.
Because that's going to have to be a language that you're fluent in if you want to be a leader in today's modern healthcare, right?
Totally.
And I think, you hit on the head. There's a lot to be said about how hard it is to gain back, land, turf that you've lost in that world, right? Because the other entities, hospitals, insurance companies are experienced in PR. They're experienced in, look at television advertising for insurance companies.
Yep.
you ask 10 people what an insurance company does, and they're convinced that the insurance company's chief primary concern is to help you as as a consumer and to for your wellness and your care and there's just an inherently positive kind of opinion of insurance companies because it's like an intentional effort to portray that. And yeah, insurance fills an obviously, I mean, it's an important role. It's an essential cog in the healthcare system, but they're better at self-marketing, self-promotion. They're better at public opinion and political advocacy and being involved on the Hill and all the things that physicians aren't interested in, frankly, and don't do well. And there is a subset of physicians that are good at the financial part of it, I would say, but even that is,
Changing.
minuscule compared to the number of people who are good at it from hospital side or insurance side or pharma side, and
the legislative side, because that's where it all drives from there.
Yeah.
I mean, look what happened here in Colorado. We kind of emergency medicine got semi-blindsided. We all came together finally, as a cohesive group, which was really important. But unfortunately, we hadn't spent the time as much as we should have to build that understanding with legislators and that trust. And so, this year, just in general, we made a concerted effort in the state to really become the go-to profession for legislators to get their information, especially in the time of COVID.
And I think emergency physicians fill that niche. And I'm biased. I mean, I fully recognize my own bias, but we fill that niche because that's what we do.
Yep.
I mean, right? Like there isn't really another specialty that as frequently as we do interacts and touches with every other specialty, medical and surgical specialties, right? That our job is to communicate things amongst players with very diverse perspectives and very diverse motivations.
Yep.
And to communicate it really on a layperson perspective to patients as well. And that's what you're doing to legislators, right? You're taking complex medical terminology and principles and trying to boil it down to a politician in a way that you think can be broadly applicable. And I think that's what we do on a daily basis. So we should take the leadership in that, In addition to what we've already touched on is, the role of medicine in COVID, right? I mean, who's being put out in the public eye? Which medical, I'm going to use that term very broadly, which medical opinions are being pushed and advocated, and the politicization of medicine and, in the era of COVID is something that we cannot allow to be dictated to us in the same way that a lot of our practice has, right? I mean, I think that has been a particularly worrisome trend, in my opinion, over the last 6 to 9 months, is that it is being, medical treatments, medical research, medical advancements, whether it's your vaccines, your therapeutics for COVID, whatever it is, they are inherently becoming political footballs. And that is not how it has been, nor how it should be.
No, but I think like the key is that as practitioners, we stand our ground and we continue to practice evidence-based medicine, right? So no matter what's out there, as long as we continue to practice what we know is true and right from a evidence-based perspective, you can't go wrong. Science is real.
Science is very real.
For those of you guys that were wondering, it is real. I'm wondering what's going to happen now that now that we have a new president-elect, and I'm hoping things will kind of get back to where you can actually tell the public you can trust what they're saying because they're basing it on science versus someone possibly making some money on the side or some tweet that they read. Yeah. So it's an interesting time.
It is.
We'll see where we come out.
It is.
Hopefully not with COVID, but I think
I sure hope not.
I think messaging is a big thing.
It is.
Take the time, tell the people around you like wear a mask, but we also have to do it. We got to do the same thing. We got to practice what we preach. So, when you're getting groups of docs or nurses, all coming down with COVID, at one time, there's other things that are happening that we need to make sure we're on top of, which is, practicing what we preach.
Yeah, right. Absolutely.
So,
absolutely.
Yeah.
Who would you say was the most influential figure in your career, if you had to pick one?
From just an all-around perspective?
Mm-hmm.
I'd say there's
Can be MG, MD, JD. Can be from your academic time, community time.
I think there's like I would say there's two people. So one person is a guy by the name of Steve Anderson. So Steve Anderson, he practices out in Washington, and for those of you who know him, you know how amazing he is. So Steve, I'll just describe him. He's a hilarious guy. He's got a rat tail, and he cares. He is someone who got good at practicing medicine, and then advocated, and so he helped change things within the state, and then he has had real life experience with things such as the loss of his daughter from an overdose, and he takes that and he uses it to drive him and help continue to facilitate change. And so from a perspective of like just wanting to be better, he's one of those people. And then the I think there's a combo of people. So the last would be a gentleman, a doc by the name of Bill Heegard, and the other one is Steve Smith. So you guys may know Steve Smith from his EKG blog. So Bill is someone who is now an admin, and he always said to me when I was a resident, the only way you can be good at admin is by being a good doc. And so his thing to me was always become a really good physician, and then figure out from there you can be a good administrator, do something outside.
That's right.
And then Steve Smith is another person that I feel like I pray that I can even come close to, even like a quarter of what he does. I mean, he's been practicing for, over, I want to say over 30 years. Sorry, Steve, I don't know if that's how old you are.
He was a doctor at 12.
Yeah.
That's right.
Yeah.
The Doogie Howser.
Yeah. I mean, Steve Smith is a genius. But the thing about him is that he is someone who just wants to be better. And so he pushes residents and asks questions that make you uncomfortable and calls you out. It may make you feel uncomfortable. That's not why he calls you out. He's saying this because he wants everyone to learn and do it the right way. And he's so passionate about it. You look at his EKG blog. I mean, this guy has been doing this for years, and you read his EKG blog and it's like a book, and the reason he does it is because he's passionate about it. And so I think that's one of those things where, like, never forget, the only way you're going to be good at something is if you enjoy it and you're passionate about it. And once you've lost that joy, maybe you should think about why, or maybe it's time to move on.
Yeah, how do you get it back?
Yeah.
Yeah.
I mean, you get it back by what you're doing. You find,
it's true.
You find other things. If you just do medicine, I don't know. I'm one of those people that believes that if your only thing is like medicine, you're going to burn out. You got to find those other pieces that make you happy in life.
That's right. Complementary pieces.
Yeah.
Absolutely.
Whether it be family, skiing, whatever, just find it. So, but that's why those three people have like really affected me in how I think about things.
Yeah.
And I always call Steve Anderson whenever I have an issue. I mean, he's the one that I'll call for advice, and he's always there. He's always like gives an amazing answer that's like great perspective. I mean, that's why I'm in our group now. Is because he was like, if that's what's going to make you happy, you got to do it. So.
Yep.
It's a hard decision.
You have to be available, and he's available, which is the start. All right, man. What's finally? What is your teaching style? What would you say that residents or APPs that work with you, or nurses, or folks when you're doing your IM stuff, how would they describe Ricky Dhaliwal, the teacher?
I think it's a combo. So I'm a see one, do one, teach one kind of person. I'm like, I will show you how to do whatever. If you want to learn, and I'm excited to do it if you do, and then you see it and then you do it. If you need help, you need help. And then I think the other part is asking questions. I will ask like probing questions to get your opinion, and then give you my insight after that. And that way you can make your own practice. Because I think the key about this is that we listen to EMRA, we listen to all these different podcasts.
Yeah, the Emergency Medical Minute.
The Emergency Medical Minute. Sorry, yeah, that's what I meant. Emergency Medical Minute. But
no, we can listen to both.
But you get all this information, and we just talked about this. There's a lot of misinformation, right? And so if you don't take the time to come up with your own opinion and have facts behind it, like read the data, you're not going to really understand why you're doing the things you're doing, and sometimes you're going to be doing wrong things because you didn't actually take the time to figure it out yourself.
And you have to stake your claim.
You do.
You can't wish and wash, and what, you have, and to your point of asking questions, tell me what you would do, right? You have to stake your claim.
Yeah.
And you can be wrong.
Yeah. I mean, and the thing is that the thing about emergency medicine is that the practice is different. There's a even within the city, things are different. Then you go regional, right? I mean, I can tell you that I do things way different probably than you do in some things, right?
Yeah, probably a lot better.
Yeah.
I've been told.
I mean, I'm not going to say that, but
But that's a
been
low
told that
bar.
too.
That's a low bar.
Yeah,
So, I would expect a little bit more from you.
Right. Yeah. I mean, yeah, that's just how it goes. But those are the things. Like, I don't think that. I mean, there's definitely wrong ways of doing things. But
Correct.
I think that there's multiple ways of doing things, and not knowing and understanding that those are out there and figuring out how you're going to go about learning it is really important. So during residency, that's the time you take, especially to understand literature and like figuring out how do I analyze this literature.
That's right.
Because you're not going to have
Your faculty mentor, walking you through an article, every other day.
Yeah.
That says, "Did you look at table 1?"
Yeah.
The groups weren't even the same. So it's like, no, but you have to learn the mechanism of how to do it.
Yeah, because I mean, the next thing you know, you're going to be giving hydroxychloroquine to a patient for COVID.
Wait.
No, you get high doses. High doses
doesn't work.
No, it works really well. You just wait till they have an arrhythmia.
It has an
give them
effect.
More.
I think we can definitively say it has an effect.
They won't get malaria. It's true.
That sounds like a lot of internal medicine. We'll have to push that back to another podcast.
Yeah. I mean, you want to talk on internal medicine?
Yeah, I am. Yeah, next time. This is the emergency medical.
Oh, yeah. Sorry about that. Hey, we do a lot of IM.
No, yeah, no. I actually, it's pretty cool that you're still keeping that practice active. It's pretty cool.
Well, I got to take the board, so.
Whoops. Board eligible physician, Dr. Ricky Dhaliwal.
That's me.
It should go fine. It should go fine. Yeah.
Yeah, that's another test.
So it's true you order more than one dose at a time? It's actually queue some number of hours?
Yeah, I mean, there is, every once in a while I do one times, but, there's a queue. That queue in front of it means something.
And you're supposed to know how often you give it on a regular basis?
I mean, it just depends. I mean, this day and age, with the number of patients we're holding, you better learn that queue.
That's right. Observational medicine is the next frontier of emergency medicine.
I mean, it's already there.
Yeah, it's true. It's true. It's the great uncompensated frontier.
Get used to it. It's all going to be acute care continuum at some point. It's going to be the ED and then the ICU, and then the rest are going to be something else.
Yep.
I don't know. Look at what dispatch health's doing. They're flipping it on its head.
Ooh, shout out.
Yeah, no, shout out, right?
Now it is the future. Speaking of the future, last question. I think I've said last question before, but this is actually the last question because
you look like you're falling asleep.
I did fall asleep twice. I'm gonna have to go back and.
This poor guy didn't overnight and got like 7 minutes of sleep. He doesn't look like it at all.
Well, it's a lot of caffeine. What does the future hold for Ricky Dhaliwal? Answer that question in whatever way you would like. 5 years, 10 years, 1 year.
I don't know. I mean, I think I have an idea of goals that I want to do. Like I want to get into admin, do more admin work, and I think I've made some decisions to get myself there, and I think I'm hoping that I'm heading there. And then I think I see myself doing that, but being in the advocacy realm for medicine, whether that be helping within the state or running for an office or something. But I think that we need more voices in medicine that are trying to push for what's best for patients and what's best for medicine as a whole, which involves physicians. Things like what just happened in our state regarding mental health for physicians. It's a travesty. Like the ability for a physician to get mental health that is confidential. Mental health help that is confidential, whether that be, for depression, substance abuse, whatever, it's
it should be a non-negotiable.
It should be a non-negotiable issue, and we just, in the middle of COVID, our governor, I'm becoming political here, but, Governor Polis just changed things, and it's because the trial lawyers had a lot of power when we didn't know was happening, right? Mm-hmm. And that's the kind of thing that we need more emergency medicine physicians, on the ground floor of legislation. Yep. And that's how you do it.
Ladies and gentlemen, Dr. Ricky Dhaliwal, not the last time he'll be on the podcast, but appreciate your time.
Thank you, sir.
Enjoyed it.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.